Today, we're going to go over 7 early symptoms of diabetes that very few people know about and that most people literally ignore every day. Some of these symptoms can even show up several years before a doctor actually makes the diagnosis. The most frustrating thing about type 2 diabetes is that it rarely starts with anything obvious. Most people don't feel any pain at all. No one wakes up in the morning thinking, I think I have diabetes. Usually, everything seems completely harmless. The skin on your neck gets darker. You start getting up at night to use the bathroom more often. Sometimes your legs cramp, and small cuts and scratches take longer to heal. And almost always, people find a perfectly logical explanation for it. Age, stress, fatigue, lack of vitamins. But sometimes, that's exactly how your body tries to warn you that your blood sugar is already high or about to go above normal. And the first symptom can look so unusual that many people spend years trying to get rid of it with loofah, scrubs, and expensive creams, never suspecting that the real cause is something else entirely. Go to a mirror right now and look at your neck, then your elbows, and the area under your arms. Are there any patches of skin that look like they just can't be washed clean? A lot of people start using scrubs, rough sponges, switch shower gels, but nothing changes because the problem isn't about hygiene at all. This condition is called acanthosis. It occurs because of elevated insulin levels. Yes, insulin affects more than just blood sugar. For some tissues in the body, it also acts as a kind of growth stimulator. Because of this, the skin in areas of friction gradually becomes thicker, rougher, and darker. And what's really interesting is that these kinds of changes can appear long before diabetes itself develops. Sometimes it takes years before a person learns their diagnosis. So if you notice that the skin on your neck or elbows is gradually changing, don't automatically blame it on age, excess weight, or poor self-care. Sometimes the body is literally screaming, there's too much insulin. The second sign usually becomes noticeable when the process has already gone quite far. This is constant dry mouth and frequent trips to the bathroom, especially at night. How is this connective? When there's too much sugar in the blood, the kidneys just can't keep up. They physically can't return all the glucose back into the bloodstream. And then the excess sugar starts to leave the body with the urine. And sugar, like a sponge, pulls water along with it. The body rapidly loses moisture. A person starts to feel intense thirst. They drink liters of water but can't quench their thirst and, of course, immediately have to run to the bathroom. Normally, a healthy person should be sleeping at night. If you consistently wake up 2, 3, or even 4 times a night just to go to the bathroom, that's a serious reason to get tested. But if dry mouth just makes us drink more water, the next symptom is much harder to miss because it starts to directly ruin our lives. When your blood sugar level is constantly high, your body literally becomes sweet. And bacteria and fungi love that. For them, it's not just blood, it's the perfect nutrient-rich environment, a real all-you-can-eat buffet. As a result, any small scratch, a simple paper cut, or a minor abrasion takes weeks to heal. All of this happens for just one reason. In a sweet environment, any infection thrives, and most people at this point make the main mistake. They think, well, maybe my immune system just got weaker, I should take some vitamins. No. Maybe your immune system has nothing to do with it, and you're just feeding infections every day with your own sugar. And while bacteria multiply on the surface of your body, inside, high blood sugar quietly starts to damage what's hardest to repair, our nerves. An excess of glucose in the blood is a real slow-acting toxin for our nervous system. In medicine, this condition is called diabetic neuropathy, and the first to be affected are the longest and thinnest nerve endings. And where are they located? That's right, in our legs and feet. The earliest and most common sign, which you should never ignore, is nighttime cramps in the calf muscles. You wake up in the middle of the night because your leg cramped up. The pain is sharp and piercing, and for several minutes you just can't move your toes. Or you might feel another strange sensation, tingling in your feet, like hundreds of tiny ants are crawling over your legs. Sometimes people describe it in even more interesting ways. They feel like they're always wearing thick wool socks or fluffy slippers, even though they're actually standing barefoot on a cold, bare floor. This also includes what's known as restless leg syndrome. That's when, in the evening or before bed, you just can't find a comfortable position for your legs. You constantly want to move them, rub them together. Otherwise, a terrible discomfort builds up inside. This is diabetes, yep. But while our legs are far away and we can ignore strange sensations in them for weeks, when diabetes affects the head, people really get scared. But for some reason, they end up going to the wrong doctor. The tiny blood vessels in the eyes are among the first to suffer from high blood sugar. People usually describe it very simply. It's like the glass suddenly fogged up, or everything around is covered in a fine haze. Sometimes vision sharpness drops suddenly, literally within a couple of weeks, and the person can no longer properly focus on their phone screen or make out a bus number. And what's the most common reaction here? That's right. The person rushes to the eye doctor, buys new glasses, and orders expensive lenses. They start using eye drops for tired eyes. But it doesn't help. The problem is that high glucose changes the eye's ability to refract light and gradually damages the tiny capillaries in the retina. And the most frustrating part is that while sugar is destroying your eyes and nerves, you feel as if all the life has just been drained out of you. It seems like a paradox. There's a lot of sugar in your blood, but you have no energy at all. You might wake up in the morning already feeling exhausted. After lunch, you literally start to nod off. You feel a strange leaden heaviness in your legs. Why does this happen? It's because the sugar simply can't get inside your cells. The cells in your body are basically starving in the midst of all this sugary abundance. There's plenty of fuel in your body, but it's not making it to the engine. And once again, we blame it on hard work, stress, bad weather, or chronic fatigue. But very often, what's really hiding behind this mask is just plain prediabetes. All these 6 symptoms can drag on for years, smoothly flowing from one to another. But if you ignore them, at some point, the body just can't take it anymore and switches on the last, most severe emergency mode. And this symptom is rare, but it's the most dangerous one. If a person doesn't get any treatment at all, their blood sugar level can skyrocket to a critical value. At this point, the body starts producing toxic byproducts of fat breakdown, ketones. The blood literally becomes acidic, and this shows up as a sudden, intense, stabbing pain in the abdomen, like being stabbed with a knife. The person doubles over, severe nausea and vomiting begin, and their temperature may rise. And you know what's the scariest part? With this kind of pain, patients are often brought by ambulance to a regular surgery department. Doctors suspect appendicitis, pancreatitis, or an ulcer. But in reality, the person urgently needs to be saved in intensive care, given insulin, before they fall into a diabetic coma. Remember, if you or your loved ones suspect high blood sugar and suddenly have severe abdominal pain, don't try to handle it yourself. Call an ambulance right away. But all these symptoms have one thing in common. The most dangerous thing is they don't hurt. You can live for years with a blood sugar of 15 and feel completely fine. Maybe you feel a bit more tired. Maybe your elbows have gotten darker. Maybe you started getting up at night a little more often. Most people just get used to it. We only go to the doctor when we have sharp pain, but diabetes doesn't hurt. And that's its main trap. Well, you don't feel anything. High blood sugar is slowly damaging the walls of your blood vessels. First, the tiniest capillaries in your eyes and kidneys are affected, then the larger blood vessels that supply your heart and brain. That's why atherosclerosis progresses so quickly in people with diabetes. And that's why the main danger isn't the sugar itself, but heart attacks and strokes. That's why a good doctor will monitor more than just your glucose. They will definitely keep 2 more indicators under control: blood pressure and cholesterol. If you keep these 3 numbers within the normal range, the risk of complications is minimal. But the most important thing to know about type 2 diabetes is that it's not a one-way street. You can reverse the process if you lose at least 10 to 15% of your body weight. Your cells will start responding to insulin again. And very often in this situation, doctors completely discontinue medications for patients. The person goes into stable remission. So if you notice even a couple of symptoms from this video, don't wait for pain. Just get a fasting blood sugar test and check your HbA1c. 2 simple tests. Sometimes they change your whole life. Subscribe to the channel so you don't miss the next video.